Hi, my name is Kerry and I'm going to be your nurse practitioner student today.
Okay.
I'd like to do an exam of your head, eyes, ears, nose, and throat today, if that's all right with
Okay.
you. Okay. I'm just going to wash my hands before we get started.
Okay.
To get us going, can you tell me your full name and date of birth?
Katie Vargo, 11/7/89.
Perfect. And can you tell me where we are?
The hospital,
Great. And can you tell me what today's date is?
February 1st, 2019.
Great. The patient is alert and oriented. Okay, so I'm going to start this exam by just doing a general inspection of your head and your face.
Okay.
So I'm looking here at your skin color. Your skin color is normal for your race. There's no obvious lesions or abnormalities or wounds. Your eyebrows are symmetrical, your eyes are symmetrical, your nose is midline, and your mouth has no facial droop, no open areas, no lesions. Your ears are symmetrical on both sides. Perfect. And I'm just going to take a look at your scalp and your hair as well, and I'm just going to touch. So I'm noting that you have a lot of hair. It's distributed evenly. There's no abnormal lumps or bumps when I palpate your skull. Your skull is symmetrical. So next what I'm going to do is I'm going to run some tests just to check your cranial nerve functions.
Okay.
So I'd like to start with I'm going to touch your temporal muscle when you clench your jaw. Great. And do it again for your masseter muscle. Great. And then open and close your mouth. Okay. So this is telling me that the motor function of your cranial nerve 5, your trigeminal nerve, is normal. And it also tells me that your temporal mandibular joint is normal because I don't feel any clicking there. Next, what I'd like to do is assess the sensory function of that cranial nerve.
Okay.
So close your eyes and tell me if you feel dullness or sharpness.
Sharp.
Perfect. So the sensory function of your trigeminal nerve or your 5th cranial nerve is intact.
Okay.
Next, what I would like you to do is to puff out your cheeks, stick out your tongue, raise your eyebrows, smile, frown. Great. So this tells me that your cranial nerve 7, which is your facial nerve, and your cranial nerve 12, which is your hypoglossal nerve, are both intact.
Okay.
Next, what I would like you to do is I want you to fight against my hand with your face. Great. And then push against my hands with your shoulders. Awesome. So this tells me that your cranial nerve 11, which is your accessory nerve, is intact.
Okay.
Next, what I would like to do is assess your eyes.
Okay.
So first I'm going to inspect. So I'm just looking at your eyelids. If you have your eyes shut, perfect. So the creases in your eyelids are normal. You have nice distribution of your eyelashes. Both of your eyes are even. Your eyebrows are even. I'm going to palpate your lacrimal sac here. There's no discharge noted. And can you open your eyes for me? Great. So your sclera on both eyes are white. Your conjunctiva are pink, which is perfect. And your irises are both noted to be brown, which is a normal appropriate color. Next, what I would like to do is test your visual acuity.
Okay.
So I'm going to have you cover your left eye. I'm going to have you read the smallest line that you can.
LTFPH.
Great. And I'm going to have you cover the other eye and do the same.
LTFPH.
Wonderful. So this tells me that your cranial nerve 2, which is your optic nerve, is intact.
Okay.
Next, what I would like to do is I would just like to get a general look at your pupils. So I'm going to have you look ahead. Great. So both of your pupils react to light when I'm shining it directly and indirectly into that eye, which tells me again that your optic nerve or your cranial nerve 2 is intact.
Okay.
So next what I would like to do is I'm actually going to take a look inside of your eye.
Okay.
So I have to turn the lights off to do so, and I'm going to raise your bed up just a little bit so you're at the appropriate height. Great, so lights are off. I'm going to turn on my thermoscope, and I'm just going to have you look ahead of my ear as I look into your right eye. So I'm looking into your eye, and I'm able to see the macula, the arterioles, the veins, and the optic disc, and all look normal. I'm going to go around to the other side to do the same. First, I'm going to check your red reflex. So I'm just going to take a look here, and your red reflex is present when I look at it. What I'm going to do next is look into your left eye. So if you could just look at my ear again. Great, so I'm able to see your macula, I'm able to see your optic disc, the arterioles, and the veins. Perfect. I'm going to go back to the other side just to quickly check your red reflex over here. So your red reflex is present. Perfect. So what I'm I'm going to do before we move on is I'm going to just test your visual fields in all areas.
Okay.
So I'm going to have you follow my finger here with your eyes. Great. And I'm going to have you tell me when you can stop seeing my fingers.
Okay.
Perfect. So this tells me that your cranial nerves 3, 4, and 6 are all intact. 3 is your oculomotor, 4 is your trochlear, and 6 is your abducens.
Okay.
So those are all working. So far, so good on your eyes. Everything looks normal.
Great.
Next, I would like to assess your ears, and I'm going to do so by just doing a general inspection. So I'm palpating your auricles here, taking a look. Both of your ears are even. I don't see any swelling or discharge. I'm going to do what's called the whisper test to start, just to check your hearing. So if you could cover your left ear, I'm going to whisper something and I want you to repeat it back.
99.
Perfect. I'm going to go to the other side to do the same. To cover your right ear.
99.
Perfect. So your hearing appears to be intact, which tells me that your 8th cranial nerve, your vestibular cochlear nerve, is intact.
Okay.
Next, I'm going to do what's called the Weber test.
Okay.
So I'm going to put this on top of your head and just tell me if you can hear it on both sides equally.
Yes.
Perfect. I'm going to do what's called the Rhine test next. So I'm going to put this behind your ear and tell me when you can stop hearing it.
Okay.
And tell me when you can stop hearing it.
Okay.
Great. So that's a normal finding. It's normal for you to be able to hear it in the air longer than you can hear it behind the bone. I'm going to do the same on the other side. Tell me when you can stop hearing it.
Okay.
And then you stop hearing it.
Okay.
Great. So next what I would like to do is look inside of your ears.
Okay.
So I'm going to turn on my light here. You're already at the appropriate height. I'm just going to pull back your pinna and insert the speculum. Take a look here. So I'm able to see your tympanic membrane, which is a pearly gray. It's intact. I see a small amount of wax, but no abnormal discharge or edema, and the cone of light is seen at 5 o'clock. I'm going to go to the other side. Going to pull back the pinna and insert the speculum. So I'm able to see your tympanic membrane. Again, it's a pearly gray. There's no abnormal drainage. There's no edema or redness noted. There's a small amount of wax, but no other drainage. So next what I'm going to do is take a look at your nose.
Okay.
So I'm going to just take a look at your septum first here, so your septum doesn't look deviated at all. I'm going to just take a look in your nose. Turn on my light here. So as I said, your septum looks midline. It doesn't look deviated at all. I'm able to visualize your turbinance because both of your nostrils are patent, and the mucosa inside of your nose looks intact with no irritation. Next, I'm going to check your sense of smell. I would like you to close your eyes and tell me what you smell.
Marker.
Perfect. Oh, sorry. So your your cranial nerve 1, which is your olfactory nerve, is intact.
Okay.
So next, what I would like to do is just to palpate your sinuses.
Okay.
So I'm going to palpate your frontal, your maxillary. Have you noticed any tenderness there?
Nope.
I'm just going to percuss them. Any more tenderness?
Nope.
They seem good to me. They seem healthy. So next what I would like to do is I'm going to take a look at your mouth. So I'm just going to take a look at the outside. So your lips look intact. There's no lesions or areas of redness noted. There's no cracking. I'm going to have you open your mouth and say ah. So your tongue looks normal, a good color. Your gums look normal. Your dentition is good. I can see your uvula and your tonsils. Good. And if you lift up the tongue for me, good. The floor of your mouth looks intact. There's no redness noted anywhere. Next, what I would like you to do is I'm going to have you swallow and say 99.
99.
Great. So both of these tests indicate that your cranial nerves 9, 10, and 12 are intact. 9 is your glossopharyngeal, 10 is your vagal, and 12 is your hypoglossal.
Okay.
So next what I would like you to do is I'm just going to take a look at your trachea here to make sure that it's midline. So there's no deviations in your trachea. There's no swelling noted to your neck, which is good. And I'm going to have you turn so I can feel your thyroid. So I'm just going to palpate here, and I don't feel any lumps noted. I'm going to have you swallow. Great. Again, I don't feel any abnormal lumps. There's no swelling noted. So I think you have a very normal exam of your head, eyes, ears, nose, and throat.
Thank you.